Hey guys, welcome back to Medical Coding with Blue. It is Answer Monday. Are you totally excited about these? I am, because we finally incorporated evaluation and management. And yes, I know I have taken my time to incorporate evaluation and management into these quizzes, but the only reason that I did is because I don't know quite sometimes how fast to go with you guys or how much intensity I should put into these quizzes. So that's why I've been sort of taking my time with it. But now that we have, I can't wait. So how do you think you did? Let me know in the comments. And just so you guys know, this is always my little disclaimer. These exercises are not official. This is just me as a veteran medical coder sharing the things that I know. This is why I have this channel, to share with you guys and to hopefully pass on something that maybe will help you in your workplace, okay? So if you have a 2017, 2018, or 2019 ICD CPT book, you should be good to go on these. If you have a 2018 or 2019 ICD-10 book, you should be good to go. All right, so let's go ahead and get started. I will be putting the answers down in the description box below, so let's go. Number 1. A 12-year-old male presents with a non-displaced right radius and ulna mid-forearm transverse fracture after falling off his skateboard. He was placed into a hanging finger traps where he underwent a closed reduction with traction and manual manipulation. A well-padded long arm plaster cast was applied. Capillary check was performed with normal reaction time and the patient tolerated well. Post-reduction radiographs were obtained immediately after cast application, which demonstrated a molded long arm cast with acceptable anatomic alignment of the fractures. Answers? S52.324A, non-displaced transverse fracture of the shaft of the right radius, initial encounter for closed fracture. S52.224A, non-displaced transverse fracture of the shaft of the right ulna, initial encounter for closed fracture. V, like in Victor, 00.131A, fall from a skateboard, initial encounter, and the procedure is 25565 with a RT modifier for closed treatment of the radius and ulnar shaft fractures with manipulation. Now, this with manipulation and without manipulation is something that you really got to watch for, because in the description he says he underwent a closed reduction. Reduction is that key word right there, so that should put your antenna up, okay? Closed reduction with traction and manual manipulation. Anytime you hear those words, you got to start looking for that manipulation. Is it documented? Is it in there? You got to start looking for that. So reduction, manipulation, traction, those are the key words you're going to be looking for, okay? That's how you're going to know whether it's going to be with manipulation or without manipulation, okay? You got to watch for those words and really understand what each one of those means when we're talking about a fracture that is being treated with manipulation versus without manipulation. Okay? So that was it on that one. And did you notice I said mid forearm instead of saying the shaft of the ulnus and the radia? So the ulna and the radius. I did that because sometimes they use different words to mean the same thing. Now, we've talked about saying mid forearm versus shaft before. We've talked about that in previous Quiz Fridays, and I brought it back because I know not everybody's had a chance to go back into the old videos to see, and I know it's like a lot of videos. I think it's like over 177, something like that, videos now that I have, so I know it's quite a bit. But we have talked about this before, so if you've been with my quizzes from the start, you know what it's like. But yes, I tried to incorporate different words so that way you guys can start looking for like similar words, okay? So something to keep in mind. All right, number 2, a 41-year-old gravida 3 asthmatic female currently 32 weeks pregnant, presents for acute exacerbation of her asthma. Medication was adjusted. She also has severe GERD. Precautions discussed to lessen the severity of GERD. Answers: 009.523, supervision of elderly multigravida, third trimester, because she is 41 years old, okay? So got to keep those little details in mind, all right? 99.513, diseases of the respiratory system complicating pregnancy, third trimester. And then J45.901, unspecified asthma with acute exacerbation. I always want to say zero. It's 099.613, diseases of the digestive system complicating pregnancy, third trimester. And then I got K21.9 for the esophageal reflux disease without esophagitis. And then I got Z3A, like an alpha, 0.32 for 32 weeks of gestation of pregnancy. Now, those elderly gravida and the one where they're under a certain age too, you got to make sure that you know the ages on those. I don't recall the age right now. I just blanked on it. The one for the really young one. But always know those, because when I first got to where I currently am and I was working in inpatient professional services, we talked about that because I was picking up that code, the elderly gravida code, and the other girls were not picking it up, and they didn't know to pick up that code. Now, I had recognized it because, like I said, at my previous place that I had worked at, we had a lot of those because we had a high-risk OBGYN department. So that was one of the specialties that they took care of, is the elderly mothers. So that was something that I recognized right away. And so when I got here, come to find out, this wasn't something that they were recognizing when they were looking at documentation. So I helped to square that away. So I wanted to make sure that we start, when we are working on these quizzes, that I am incorporating some of those quirky things that happen with OBGYN, because OBGYN coding does get a little bit more detailed. So I just wanted to share with you guys something that you got to kind of watch for. Okay, so all right. So number 3, referring to the 1995 Evaluation and Management Guidelines, name all 14 designated systems for the review of systems. Answer: constitutional, eyes, ear, nose, mouth, and throat, or you can put ENMT, cardiovascular, neurological, gastrointestinal, musculoskeletal, respiratory, genitourinary, the heme and the lymphatic system, okay, psychological, allergies or immunizations, integumentary, and endocrine. Okay, that makes all 14. Okay. Number 4, name the one system that is not a designated system for the physical exam. And that answer is endocrine. You know, you would think that endocrine, like, because I'm thinking about sweat and all this other stuff, and sweat falls under the skin. And I've found more than one resource that says this too. And so it's just like, really? So I just wanted to kind of point that one out too, because when you're looking at and you're helping your providers maybe do templates and things like that, where they're starting to set up, however many systems or whatever that they're covering, that is something to note, that endocrine is not in the physical exam system. So number 5, name all the possible choices of elements of history of present illness. Okay, I didn't tell you guys how much it was this time, okay, because I wanted to see if you guys got it. So the answer: location, duration, modifying factors, quality, severity, timing, context, and associated signs and symptoms. So I think we can do part of the next quiz, breaking down like what each one of them means. Okay, so that way, because I know sometimes it does get a little bit like, well, what do they mean when they say this? So let me work on it. But hopefully you guys got those all. Okay, so number 6, the patient presents to the ER. He is a 26-year-old male who is medevac from Iraq, where he had been deployed for 4 months. He was diagnosed with severe pneumonia while there and is requiring a higher level of care. Pulmonary service was consulted. After reviewing his radiology, a DVT was seen on his left femoral vein as well as a pulmonary embolism. Anticoagulants were immediately administered. I got J18.9 for pneumonia. I got I82.412 acute embolism and thrombosis of left femoral vein. And I got I26.99 other pulmonary embolism without acute cor pulmonale. And then I got Z91.82 personal history of military deployment. Now, why is this personal history of military deployment important? Okay, anytime you have a soldier, okay, that something happened to them when they were deployed, or while they were deployed, XYZ happened, you need to put that history code in there. It is very important for statistical purposes and a myriad of other things, okay? But most importantly, it needs to be documented that this happened to, when did this happen to this patient? Okay, so if he was out there and he got pneumonia, anything could have happened. So it's very important whenever you see, like in this instance, this was something that he came in for. I mean, he was out there and then he came to the ER because they transferred him here, according to this scenario. This is very important to make sure that you're paying attention to those little details, okay? And if you're working in the ER, this is very important because all the information that is gathered while the patient is there in the ER is very helpful for the other services that get consulted. So if pulmonary came in and they didn't know that this patient was deployed and that he came from overseas, maybe there's different tests that they need to run. You know, maybe he was exposed to something while he was out there. There is a myriad of things that can happen. So always, always, always get as many details as you can, especially if you're working in the ER and they're coming in like that. Also important to note, like if the patient has, you know, long-term use of anticoagulants or long-term use of oxygen, things like that. These things are also important to put on there. Now, why did we not put long-term use anticoagulants? Because the patient came in and they spotted it on the radiology. So that was why he was put on there. He was put on the anticoagulants. You're not going to code the long-term use anticoagulants right now because they're doing this to stabilize him, okay? So he's not going to be able to get that. Now, if he gets discharged and they send him home and they put him on long-term use anticoagulants and he goes back for his doctor's appointment, you know, days later or maybe a month later or whatever, and he's still on the anticoagulants, then you can put long-term current use anticoagulants, okay? But not when he is there at the hospital. You will not put that on there, okay? So just something to know. All right, number 7. A flexible diagnostic laryngoscopy was performed along with a bilateral diagnostic nasal endoscopy. The same endoscope was used. Answer: 31575 laryngoscopy flexible diagnostic only. Now, why did we get this? Because if you look in the book specifically tells you do not report 31575 in conjunction with 31231, which would have been the bilateral diagnostic nasal endoscopy, okay? Unless performed for a separate condition using a separate endoscope. Now, I realize I did not give a diagnosis for this one, but I did specifically say that the same endoscope was used, okay? So I hope that you guys caught that little nuance right there, because that's what I'm, especially when I'm doing these little short ones, you really have to kind of look at those things. And I hope that when you were looking through in the book that you caught it, okay? Because it does specifically note that. All right. So, let's see. Number 9, laryngoscopy direct with tracheoscopy for aspiration diagnostic for a 5-month-old. Answer 31525 except newborn. Okay, so it's the laryngoscopy direct with tracheoscopy for aspiration. It is the one that it has except for newborn, because newborns are considered newborns up to 28 days old. So this baby is 5 months old, so he is out of that newborn phase. So that is why it is 31525. So another one. Okay, number 10, the final one. Okay, what is the CPT code for removal of lung single lobe other than pneumonectomy? And I hope I said that right. I got 32480, removal of lung other than pneumonectomy, single lobe lobectomy. That's it. That is Quiz Friday's Answer Monday for you. So how do you think you guys did? Was this easy? Was this too hard? Was this middle of the road? Let me know. And if you need me to concentrate a little bit more on something like a particular service, let me know. We are still in pulmonary. I think we got a couple more for pulmonary, or we may have one more week for pulmonary. I have to go back and look. But because it seems like we've been on pulmonary for a little while now. That, or I may be just kind of running in everything together because I've been putting out fires with pulmonary lately at work. So that could be it too. But I am going to be working on Vlogmas next. So stay tuned for that. And I will see y'all in a little while. Bye.